Thank you. So, next question. How long after having a vaccine a person can feel safe to go out with precaution? And Assalamu alaikum, how long after the second vaccine will I be able to see and hug my primary age grandchildren and know that I'm safe? That, obviously, I think a lot of people are struggling with that, the social interaction aspect of it. So I think they're very eager to try and get this vaccine done so they go meet their family members and loved ones. Dr. Naseem, would you like to take that one?
Yeah, I think after the first jab, you tend to get some protection, and after quite a lot of protection, and then after the second jab, you've got more protection. But you have to remember, you have to carry on following the government guidelines, what the government says, and we have to rely on their advice. So if the advice is that you have to wear a face mask and you shouldn't be going next door to meet your mum and dad or whatever, we have to keep on following that until the guidelines come through to us. That's both a legal obligation and also a moral obligation, I think. In terms of that's my viewpoint on it. I think we should be dictated by what people in authority tell us, and take heed of that.
And the reason for that is because even though you will have had your 2 doses and the protection, there may be others you come into contact with who haven't, and they can still get COVID because you might be carrying it but not know it because you're so well because of the vaccine. They can get it from you and get very, very ill. But that risk is reduced drastically when larger and larger proportions of the population have had both their doses, which is why I keep going back to the 70–80% of the population number. That's the kind of the magic number that we think we're going to need to vaccinate to be able to just go back to normal.
This is where the concept of herd immunity comes into place, and sometimes in practice we try to explain this to patients that having the vaccine is not just for them, it's for the wider public in general, so this stops being a pandemic, stops spreading the way it's spreading. That's really important.
We mustn't lose sight of the fact that in this wave we've got twice as many numbers of people in hospital beds than in the first wave, and we have more people on ventilators in this wave than we did in the first wave. And the first wave went up and down quite quickly. This has been a continuous rise. It's a very wide and long time period. It's had a lot of strain on the NHS, and so it's not just necessarily about how many people can vaccinate as well. We have to look at the numbers and the statistics and see as the deaths are coming down and the cases are falling. And then, inshallah, the hope is that we can then start to open up things as per the government guidance.
Okay, thank you very much.